evenings, and just so many parents with children, which has been a really encouraging thing to see. So I see some folks are beginning to join. Welcome. Well, what we'd ask that you do is in the chat feature at the, should be at the bottom of your screen, please just rate who you are, the organization that you're with, where you're from, and let us know the favorite thing that you like to do outside. My name is Christian Beckwith, and I'm living here in Jackson, Wyoming, and we'll be talking with a couple of folks who are with us today, Jennell Rempel and Sonya Jakubec out of Calgary, Alberta. And we've got an episode today that's relatively pertinent to this moment in time. It's nature, grief, and COVID-19, connecting people to parks during times of loss. I am Christian Beckwith. I'm the executive director of SHIFT, and together with Dr. Arika Virapongsi and Meredith Davison, we put together this Health and Nature webinar series. It is sponsored by the National Park Service, to whom we are very grateful for their support. And our organization helps to advance and promote the health benefits of time outside. And historically, this is something that we've done every October in Jackson, Wyoming. We're watching to see what form that'll take this year. But traditionally, we pull together folks from our stakeholder communities in outdoor rec, conservation, land management, and public health to explore issues of relevance at the nexus of health and nature. And we also have a program called the Emerging Leaders Program that brings in early career leaders from those sectors to help advance our work at SHIFT, and then to be able to return to their communities to do similar work with more training when they return home. And the two main things that we're trying to do with SHIFT are, number one, to help develop the evidence base for the health benefits of time outside, and also to help develop a narrative around the health benefits of time outside with partners in our various stakeholder communities that can allow all stakeholders to promote these health benefits using the same language, lexicon, and story. And this Health and Nature webinar series ties into both objectives. By featuring innovators and thought leaders at the forefront of the health and nature movement, the series is designed to help focus the research community on gaps and needs in the evidence base while promoting broader adoption of nature as a public health strategy. So we developed all of this in December. Of course, that was a different world and a different time. But we developed 4 chapters, and the first chapter that would help us open up the series overall. And so this is part of chapter 2, which is the public health component, looking at nature as a public health intervention strategy. Chapter 3 is focused on conservation, chapter 4 on land management, and chapter 5 on outdoor recreation. But as I said, we developed this in December. It is a different world. So what we've been doing as well is complementing the regularly scheduled programming with special episodes featuring folks who can help us talk about this, the nature and the health benefits of nature within the greater context of COVID-19, since it is the context within which we're all living right now. And last week in the New York Times, if you've had a chance to read it, R.L. Kwan published a piece on the societal prevalence of grief amid the pandemic. And above and beyond the obvious catalyst sweeping the world as the death toll approaches 25,000 here in the US and 125,000 internationally, there's a less specific but perhaps more pervasive sense of grief that Kwan wrote about that's enveloping us as we lose both the familiar and the normalcy of life that has been swept away by the virus. Many of us are obviously very aware of the benefits that nature can provide and the sort of perspective that it brings us when we're outside. But this is perhaps even more relevant now. And increasingly studies are indicating that it can also provide solace, something that is proving more valuable as we navigate the unprecedented uncertainties of this moment. So today, we're inviting 2 collaborators who have studied the relationship between parks and nature during times of loss to talk to us about their findings and how we can turn to the natural world for both physical and emotional well-being. We have with us today Sonya Jakubec, RN, PhD. She's a professor at Mount Royal University in Calgary, Alberta, where she teaches in the Faculty of Health, Community, and Education. Sonya is a researcher and academic who has served as a mental health nurse for nearly 30 years. Her research concentrates on health and environment connection across the lifespan. She has published on social determinants of mental health, mental well-being related to community recreation and parks inclusion, as well as family and caregiver needs and illness and end-of-life situations. Her specialties include community engaged research, as well as implementation issues for practical impact and social change. We also have with us today Jennell Rempel. She has over 15 years of experience of exploring ways of connecting people with parks and natural spaces. As the community and partner relations team lead in the Kananaskis region of Alberta Parks with the Ministry of Environment and Parks in Alberta in Canada, she works with nonprofit societies and community partners to enhance people's connections with parks through project work, volunteerism, and programming. She too is based out of Calgary, and her regional scope includes urban parks, as well as the vast multi-use and conserved areas of her community, and providing a variety of settings for partners to gather, share, and learn. And over the past 4 years, Jennell and Sonya have collaborated on research that has informed parks on how they can better support people during grief, loss, and end of life. With today's presentation, we've asked them to share with us some of their takeaways and to highlight the ways parks and nature can provide peace and comfort and help us with grief in the midst of a global public health crisis. This presentation is being recorded for later distribution via our Slack channel at Shift Nature Health and on our YouTube channel. Following their presentation, there will be a Q&A session. So participants, if you have questions that you would like to ask, we ask that you post them in the Q&A section of this Zoom app and include your names, titles, and the organizations that you represent. So now I will turn it over to Sonya and Jennell. Thank you so much for joining us from Calgary today.
Well, thank you so much, Christian, and everybody that's involved here today, the National Park Service. We are so pleased to be able to share really peace in the parks is what we really talk about as one of the projects and the lessons learned. And we want to share these lessons learned about the parks and nature in crisis, loss, death, grief, and memorializing, and really how this fits really with public health and parks and programming. So from a very practical level as well. And we see on the chat, so many of you, and thank you for being here with us as well, to learn from all sectors. And we're interested to have conversation as well at the end. So while the current pandemic is a public health crisis and we're experiencing health work, we know that death, dying, grief, and loss, they're social and not medical experiences entirely. And we best support these experiences from a community level, such as the experience of supporting a person for a last view of the mountains that they love, such as this image from Kananaskis with a volunteer-supported adapted hiking program. The time come right now, we're not in our parks, and that's why we've changed our title a little bit here to Peace and the Parks rather than in that we're not in parks as much as we have been, and people are craving that connection again. Time will come when we're back, but now is the time to savor memories and our plans for the next journey and to think about this profound connection. Next slide. We want to acknowledge the many partnerships and ways of working together. Just get you to move to the next slide for us. These are partnerships that have helped us have this conversation and find our way to a new normal. We acknowledge those working with us in the academic, park sector, health sector, nonprofit community, and we especially want to acknowledge the land and to show how these COVID-19 guidelines that you see here for being on the land during a pandemic from the Anishinaabe Aski Nation, an organization representing 49 First Nation communities across Treaties 9 and 5 in Northern Ontario, this huge swath of land. So knowing that Indigenous have suffered historically from pandemics, and Indigenous knowledge provides us guidelines and values about this connection of people and parks in grief and loss. It's instructive for us to think very holistically and historically in this way as well. So we acknowledge the land and all of the land you're coming from. Next slide. So we also acknowledge and we situate our work that we present here from a perspective of the Healthy Parks, Healthy People movement, which many of you on this call are also involved. as well as the compassionate communities movement in the public health and palliative care sector. And this is a movement that concentrates on community involvement in support and care for our communities, acknowledging the loss, grief, and death that are not medical experiences, but rather, as I said, social experiences where communities are equal partners in this care, in context, in place, and returning to what people from that compassionate community perspective refer to as natural caring. Next slide. And Jennell.
And so, as we mentioned, as Sonya mentioned at the start of the presentation, that here in Canada, that many agencies have taken the approach of limiting access to parks and protected areas, and by closing access to parking lots, washroom facilities, and things like that, as a way of helping to decrease the spread of the COVID-19 virus. However, one of the things that we have heard is the desire to connect with nature. And so parks organizations and partners and things like that are all working together to help create a collaborative narrative to help reconnect people to nature, or at least help to facilitate those connections to nature. And that's a large part of what we'll be bringing to the talk today, is some of those practical and very human approaches for connecting to nature, when maybe at this time we're not able to get into some of our most favorite places, but some of the ways that we can help to savor and bring those into our homes and into our yards and communities to help enhance those connections we can have in the not too distant future. Next slide. Oh, this is an image from here in Canada, in Vancouver. As you can see, the date at the bottom, March 20th. So this is definitely within, very much within the COVID-19 emergency response period. And you can see that there is this desire for people to get out and to connect with these beautiful spaces and to breathe the fresh air. And as we can see in this slide, that it's very difficult to practice the physical distancing and social distancing that we have been very much trying to incorporate into our daily lives. And so next slide, if you don't mind.
So our collaboration then is this real-time, deeply rooted connection of parks and trying to navigate our public health response and situation, and through compassionate community work that we like to say is the hiking boot meets the nursing shoe. It's really work about inclusion, addressing policy gaps, and from a very practical and programmatic sense. And we talk about programmatic senses in kind of some very small and material ways, not in grand, expensive, costly programs that we really cannot institute, certainly in times that we're facing right now. So these are public health approaches, ecological approaches to grief, loss, palliative care, and end of life, that really point to many opportunities for us in this pandemic response. And that's what we'll be connecting you with today. Next slide.
So one of those approaches is the Alberta Parks Inclusion Plan, which has been tagged as Everyone Belongs Outside. This is one of a number of different initiatives that agencies have been taking. And this is one approach that Alberta Parks has been taking to help formalize and empower not just the park sector, but also our partners, to help align the way that we're working together to ensure that we are supporting communities across work spectrums as well as across the lifespan, so that we are helping to create programs, initiatives, and approaches that are truly resilient and help to support people getting into nature, and help to support parks agencies in supporting people getting out in the ways that are most appropriate to them in the times that they need it, when they need it, and how they would like to do that. Next slide.
So those plans, and Everyone Belongs Outside, were a catalyst for research and programming that led to a study on nature inclusion and for mental well-being for adults with disabilities and their caregivers. This was a project that looked at helping empower agents and individuals to address barriers, including those barriers that now we can relate that are set up through COVID-19. But we and others have learned about how to empower and enable connections in positive ways throughout the lifespan, in ways that affect individuals and caregivers alike. And that's one of the key pieces we want to highlight today is the impact for caregivers. So you can see in this picture, Dan and Chris, who's a volunteer and caregiver who's assisting someone with disability to have a park experience, and who gets as much out of that experience as the participant themselves. We're all participants. And as Jennell mentioned in the policy, everyone belongs outside. So we can think about this right now in terms of the professional and family caregiver needs as we're addressing our pandemic response and social distancing and the need across the board for professional caregivers who are most definitely suffering inordinately right now as well. So what we learned in this particular project was around those effects for caregivers. We want to highlight that. We also learned about the different kind of day trips that we had pre and post survey work with, looked at depression and quality of life inventories. And we found that whether it was a day trip, a week-long trip in the urban front or back country, it didn't matter. The length of experience, the weather, it didn't matter. Everyone belongs outside, and those benefits and well-being benefits were felt across the board. Next slide. We have some really wonderful knowledge translation pieces and articles around that project. And it's a project that, and we reference those at the end of our presentation for you, but that initial study is what led us to this, that sort of series of further studies that looked at palliative care and caregiver and patients and family needs alike. In the first of these studies, we entitled Nature Teaches Us to Grieve. In this study, we surveyed people across the province of Alberta, as well as interviewing 15 people for in-depth native style interviews. We found in that study that parks can provide physical, emotional, and spiritual comfort at end of life. We heard from everybody across the board that it didn't matter, that despite the risks, people wanted to have their end of life or palliative experiences connected to parks and nature. In that study, we see these kind of key themes here on our slides for you. The key theme that nature teaches us to grieve really highlights the kind of natural companions that were important for our participants, pets and animals, bringing that baby goat to grandma's hospice bed, the bird feeders and observing the birds, just in a very small interaction, watching the trees, having a garden, and so on. We're just teachers and companions in a kind of classroom for people that were experiencing end of life. And again, we find some really key resonance here for people that are experiencing the barriers and constraints of grief and loss in the COVID crisis. Bookending that main theme was this kind of connected nature connecting us to death, and death connecting us to nature story and theme. The idea that there were monuments full of decay and restoration there for us, the cycles of death and life. That risk was a reminder of vitality for people, that certainly in terms of traumatic injury and death in parks, that's what nature held out for us as well, was that there is a kind of level of risk in that vitality. Again, some key lessons for us right now in the risks that people are experiencing and facing in the pandemic. That death connects us to nature. The other bookend was the sense that death is a place. And we heard this predominantly from people that, I'm in this bad place, or I was in a bad place in grief and loss. And we hear about this kind of placing death into a place. We heard from people that death was bigger that nature was bigger than death in life. And we conducted our interviews after a terrible flood and disaster in the city of Calgary, where our participants talked about, if this park and this site can survive this crisis, then I certainly can as well. We really saw that nature to people was bigger than death in life, and that parks were a container for their grief, that they could go out to their favorite sites or to a special place and scream and let their grief free. Next slide. That death connects us to nature, was found in these very profound narratives we heard over and over again from our participants. In our narrative process, we asked participants to share the beginning, middle, and end of their stories of parks connections. And in the story of a survivor's experience of traumatic death at parks, a woman who witnessed a climbing partner die in the Rocky Mountains shared the connection to us in this way. She said, "It's like you have this pet shark you really love. That nature's this pet shark that eats your buddy. The mountains ate my friends. How do you come to terms with that? The theme that nature connects us to death was vivid in these accounts. Next slide. That death connected to nature was also found in narratives, specifically this account of a participant we interviewed just a week after the natural burial of a close friend. He talked about the family discovering how they could retrieve the body from the hospital, preparing and laying the body on a Hudson's Bay blanket in a casket made from barnwood from his property with handles from the old horseshoes. He told us, here's a guy that lived 93 years and spent most of his life outdoors and has a real affinity and connection to the land. That death connects us to nature. And the next slide. Finally, the larger narrative of the project, that nature teaches us to grieve, was uncovered in account after account. Stories such as this one from a woman whose son had died in a hospice where she continued to volunteer in their garden, and in details of the annual pilgrimage made to a memorial forest in a city park, provincial park in the city of Calgary, where a partnership with a funeral home enables planting in memory of those who've died. It really enabled this site of memorialization, and these peace gardens and hospice gardens do the same. The forest and parks itself become a place of pilgrimage and a sanctuary, and I think a solace that Christian was mentioning in our introduction. It provided this solace for this grieving mother who told us she and her husband would come annually to the site. They would volunteer in the garden. She said, here we get in touch with our grief. Our grief is always on the surface. When we come here, we let go. And we have this beautiful picture from Horatio's garden, which is a garden development program in the UK, referenced again at the end of our slides. So nature teaches us to grieve, this sort of key theme, became a source of many outcomes for us and future and other development and work. It enabled us to look at training and lookbooks and walking groups and programming. Why? Because people heard about this kind of program, this sort of discovery, and just wanted to be involved. Next slide. These calls to something from nature teaches us to grieve were amazing. People were wanting to volunteer and focus. Why? It's, people quietly are grieving indoors in isolation, and we see this in terms of the tension we're experiencing right now with COVID. This mass grief that we're experiencing. Without even naming death, we say that people have passed. We barely publicly acknowledge losses, and now we're having mass losses. Death is glossed over culturally and socially. We refer to celebrations of life now rather than sitting with death in a public way. We're called really privately, and yet collectively we want to grieve socially, and you're hearing about people even grieving not being able to have funerals and memorials at this time as well. Next slide. So in our parks, we see artifacts after artifacts and ways that people are trying to grieve, find ways to grieve in parks, the way parks provide companionship in their grief. We know that people find solace in reminiscing and going back to places, if in very surreptitious and quiet ways, sneaking into that favorite rose garden to distribute ashes in the middle of the night. We see these memorials set up in our parks and cemeteries, like this one. Remains, they're scattered, as I said. The hillside bagpipe music, musings, and a glass of scotch to dad on a quiet afternoon. The collection of men's ties decorating a favorite tree in a special forest grove. See nature in our memorial statements of nature. We see flowers and sunset, mountains and rivers, and even in very casual, small natural memorials set up like this one that you see on the slide here in an urban park in the Weaselhead, which is in southwest Calgary where I live. This is where Ken Schiffner's, and I don't know Ken Schiffner, I don't know his sister, but his twin sister laid out this laminated memorial on a pathway. She set up this on a recipe card with Ken's picture at the base of a tree, writing to us that Ken, born on Feb 27th, 1948 to Feb 10th, 28, twin brother Ken fell here and died very cold, -21 degrees Celsius and heavy snow day, Saturday early morning while jogging in the Weaselhead. Loved. We see these connections and calling out. Next slide.
And so
And
one of the
Jennell.
ways that, yeah. Sorry, I love that Ken slide. Just like if we are not Ken ourselves, we know a Ken, right? Who is out there jogging on a -21-degree day in the snow, right? And that nature does just get into your skin and into your blood. And one of the ways as a parks agency or a parks agency partner can become involved in this process of commemoration and dedication is what we see in the slide here. And so the dedication bench program example that we have here is from Edmonton. And Don Iveson, who we're referencing here, is the mayor of Edmonton. And so the post is from Brandon Craig, and it reads, "Thank you, Don, for donating a bench in my late father's name. Thank you for making this Father's Day a little bit easier for my family." And the picture shows him sitting on the bench on this absolutely beautiful summer day. He truly was a kind and humble man. He loved this park and would often walk here to stay active during his chemotherapy treatments. And so in this one slide, we as a parks agency, or anyone for that matter, have a glimpse of the many layers of effect that the commemoration and sort of the being able to channel the desire to have that commemoration and be part of that larger conversation. You can see all of the different ways that nature is helping to support this entire community, whether it's Dawn, whether it's Brandon, whether it's Brandon's father, Brent, what have you. And so commemorative programs like this are never easy. And I saw in the chat box that we've got one question already coming up about that, so we can talk about it in more depth in a few moments. But by having a more formalized approach, we get a bit more of a chance to be involved in the story and to be able to see the depth with which families and communities are utilizing our parks and natural spaces. Next slide. And I love this too. This is something that we're really seeing a lot on our pathways and in our communities during the pandemic response is this very public approach to messaging and support and commemoration of this larger grieving process that we're all going through right now. And so messages such as keep going and be safe and be strong and be kind and we're in this together, we're starting to see more and more, and we're starting to see it on places like this, pathways where people are flocking for exercise and for a sense of relief. Next slide. And so, Sonya, do you want to talk on this one, or would you like me to talk on this one?
Yeah, sure, a little bit. I mean, one of, again, the sort of request and outbring as a result of our original studies, Nature Teaches Us to Grieve, and our disability parks access study, you know, we really heard from people that we want to do something. And do something, one of the things that Alberta Parks and through the Friends of Fish Creek Provincial Park Society, we're able to establish a conduit and a way for people, volunteers, community supports channel, not as park companions, not grief therapists. And I guess one of the lessons learned we want to highlight is around this park companionship model. You know, observing the cycles of the season, staying grounded in the place, and just being together in nature in kind of quiet and gentle ways, not as therapists, not as a kind of medical program, again, in the companionship and community compassionate model that we spoke of earlier. So this is walking at a physical distance is possible even now. And the experiences of participants over years in a Good Grief walking program, it's really established in that companionship model, have shown us how resiliency can be built, and has then supported people who were suffering and experiencing grief, who become volunteers, such as these volunteers you see in this photo right here. To the point, you know, and volunteering and being really engaged has motivated some of the participants to do their own walking programs, in a sense, just normalizing walk through grief that has happened. Next slide. We have conducted formal evaluation in collaboration with our university and the Friends of Fish Creek and Alberta Parks to really show us some other, again, pieces that are relevant around very small walking programs or connections like this companionship program that relates as well to our COVID and post-COVID response. So the benefits we heard from this kind of walking program were such that both were making connections and realizing we're not alone in our pain, something we're called to again right now in the we're all in it together and stay strong motif. And disconnecting pain and just enjoying the moment. So that idea of connecting and disconnecting stood out. Motivations such as pushing myself to face what I have avoided, meeting like-minded people to share and learn, were all, again, some of the results of this program. Next slide. So in a Parks Access research study for people in hospice or community-based palliative care, and next level of study, next slide, we wanted to capture stories of what took, not just what it took to conduct kind of a walking kind of projects. Next slide for us, Christian. But to really look at what it took for people to get access who have other barriers, physical and other barriers. So you can observe and hear more about this piece in the Parks project. That is the title of really our presentation today, and that you can link to in a video presentation as well. It's linked at the end of this slide presentation. But what we learned in this Park Access study by taking individuals in palliative care and their families to park settings for an experience in the park towards the end of their life. Were many individual social and park process discoveries. We learned the individual calming, reflection, reminiscing, feeling and sensing that happened. You know, that food tastes better here, that here I'm free. And this was even from very small park interactions, a 20-minute drive away to a little park setting and a 100-meter walk to look at a bird feeder. This social and relational discoveries of reminiscing and re-experiencing together, what people call just being human together. It's important to just be a wife again, we heard from people. And we're hearing this right now in our pandemic situation as well. I just want, you know, some bit of normalcy again, and that park experience has provided that connection. Here we can park palliative care, is what we heard about. You know, I'm just a human being out here in the park. I'm not a patient. And the park processes we heard about were the kind of unique access needs for people, looking at typical barriers, services and supports that really had very small solutions attached to them. Again, not huge, grand, programmatic changes. Just valuing parking and sitting areas, the 100-meter walks. We also learned that access really does take planning, information, and communication, and some of these kind of very small communication resources that would be useful. Next slide. So we see some of these potential activities and solutions in Ned's Grayscape. Here's a beautiful image from a colleague of mine whose father recently died in a hospice, where nearby there's parks, where nearby there's just streets that a person can wheel away on with their family and have that last view of the moon, to have that last breath, that fresh air that brings joy, and a little something wilder in what can be a very contained and barriered experience. And see this pursuit of a great escape that people are seeking right now, the pursuit of something wilder, and a very small intervention that just relies upon a mindset that this is possible. You know, so often when we feel unwell or near the end of life or drained from our work or caregiving or homeschooling, as many people are doing, sometimes going out seems hard or like the last thing, but that great escape is always worth it. And that's something we heard from our research. Next slide, and Jennell.
And so one of these small initiatives that has really brought together a number of different approaches to parks management is the Cecile Buell 1 kilometer experience. And this program is named in commemoration of Cecile in the picture here, who is one of our volunteers who really helped us to understand in a very visceral way how our parks infrastructure is experienced from people from a variety of perspectives. And so she participated in facility audits, as well as that's such a small piece of what she did, but it was the facility audits that really helped us to shape the 1 kilometer experience. And so within 1 kilometer of a parking lot, any of our sites that have a 1 kilometer experience site within them have paved parking areas that do meet a level of accessibility directly to an accessible washroom facility, as well as to an accessible pathway. And the pathway itself has an oomph. It's got a reason to go there. It's not just simply a pathway around a parking lot or something like that. There is a viewpoint. There is a viewing platform. There is a waterfall in one of our sites. And so I sense that through our COVID response that small initiatives like the 1 kilometer experience are going to be of value to many, many more people than we ever would have initially guessed, because a lot of people are not, myself included, are not necessarily as resilient as we may have been. And the level of persistent anxiety and grief many of us are feeling, many of us just need a chance to get outside and to have, as Sonya said, just even a brief moment of respite in nature. And so our 1 kilometer experiences are one of the ways we can do that. Next slide.
So in other ways that we're, attempting, and I think you've had this so beautifully, Jennell, attempting to make this action possible and make these kind of small changes in our mindset and changes in practical activity really come through patient and visitor engagement and a collective action, supporting a vision, a mindset with co-design, with integration, with shared products that we're creating. This is not proprietary work. We're very happy to share some of our results, research results, certainly in research papers, but also in video and in some of the documents that we've been able to produce. And Jennell and I share presenting like this, and it's really shared with our participants. And here you see Bev, who we learned so much from, and who has really supported us in thinking about those minor changes that have to happen in a paving movement or at a site, the kind of information needs that people have. So this piece around relationships and deeply listening to our community. In palliative care, we say that end-of-life conversations are not actually hard or difficult. They just have to happen. They're tender conversations, important and more important than ever as we're reaching out, engaging, including people with openness in trying to understand a grief and loss in this pandemic. And this is for one. Everyone belongs outside. We'll kind of circle back. And I'll circle to our last slide. As Megan Devine says, grief is simply love in its most wild and painful form. It is natural and sane response to loss. Really, there's nothing more natural than death and loss. And the thing that this pandemic is helping us understand, one of the things, there's so many lessons for us in many ways, but we are reading this profound question of parks, natural spaces, and their value and their necessity. And our work together to support grief is more important than ever. It is simple, and it's for everyone, and it is always worth it. We've discovered this essential role through our research, and these connections fit more important now. Certainly the parks are waiting now, and they'll be there when this pandemic is resolved. And we just are open now to questions about how we can make these connections more together. We'll open to conversation, and I guess back to Christian.
Wow, thank you both so much for that presentation and for sharing the results of your research with us. We have gotten a number of questions. If you have questions for Jennell and Sonya, please put them into the Q&A section at the bottom of the screen. And the first one is from Scott Briscoe, and it's just about the article that I mentioned at the start. It's by R.O. Kwan, and it was published in the New York Times last Wednesday. Chuck Lennox asks, how can we take advantage of this interest in nature and the outdoors once the pandemic ends? What are your responses to Chuck?
Jennell, did you want to start with that piece around the way parks are thinking about building on this kind of new raised awareness? I think that awareness is really writ large for us. We're seeing those people flocking, even sometimes breaching the social distancing rule, flocking and craving. And yeah, I'm curious too about how we can support the learning and make the connections with part of the planning as well.
For sure. And so I think a lot of it has to do with building on the tools we already have, rather than trying to create new initiatives or new approaches that during this time of people staying home and being more within their homes, there are many tools that we have at play through the internet, through our already existing websites, things like that, that with some simple tweaks and with enhancing some personal connections. So whether that be adding some narrative content to our social media feeds that help to link people back to the more solid based foundational information, all of that I think can really help to support some of those more personal approaches that can support people in planning their approaches to accessing nature, that can help people to view their communities in a way that is much more natural and wild than perhaps they may have even just a few weeks ago. And so starting to tap into some of our plant ID and nature identification and nature appreciation apps and websites and things like that can all help to bridge that gap so that people are able to use their senses, people are able to be more human in their yards, in their homes, in their communities in a way that perhaps there wasn't necessarily that craving before, but now, especially in areas here in Canada where we're not able to access some of those more wild adventures, that creating those wild adventures within our homes and within our hearts means that when we are able to then venture further, that those experiences will be richer, they'll be deeper, and we'll all be better empowered to take people with us. And so bringing those folks who maybe are less comfortable on the trail or who are less comfortable with having some of those wild experiences, that this can help to bridge those gaps as well. And that's one of the things our research spoke to so greatly, was that the role of the caregiver, the role of the person helping to support someone else's nature experience is incredibly valuable and lasts with you a very, very long time. Thanks.
That's great. We have a question from Bob Ratcliffe of the National Park Service. And he asked, please share suggestions on how we can better plan or design parks for dedicated space for reflection, solace, meditation, and now post-COVID recovery. Do you have any suggestions for Bob?
I think one of the biggest things is on collaboration and engagement, that anything where you're looking at serving your community in that way it's important to involve the community in that planning and in the discussion process. So that one of the things I think that the research really pointed to was the fact that people are utilizing these spaces in that way already. And whenever we can invite that conversation and invite ourselves into that conversation, we can start to view our parks and natural spaces through their eyes and learn about what's already happening. And I think that's a really valuable first step in helping to inform that planning process so that we are helping to do something that is the right thing in the right spot at the right time.
That was wonderful.
I just want to step in there a little bit too around the kind of the public health section with that work and that planning as well, and recognition that these are community health and health promoting experiences as well, and to engage with public health practitioners and planners as well in that decision making. And I think we're seeing that in some of urban planning activities right now around opening streets up and looking at community activities that allow for the social distancing, allow for these public health interventions in place that are really situating people in an additionally health promoting environment. We're really recognizing this mental health promotion for getting outside now. So that intersection and collaborative work is and what we've discovered through our studies. But I think we're seeing this. We need to capitalize on that right now and keep that momentum going.
Mm-hmm. Stephanie Thomas with Teton County Search and Rescue was inquiring about where these links to the sort of research that you're referencing will be stored. And I just wanted to point out to Stephanie that this will be on the YouTube channel when we put this up, also on Figshare. And then what we're encouraging people to do is to continue these conversations on the Slack channel at Shift Nature Health. We also have a question from Susan Allison Dean. And let's see, I'm trying to read this on my phone, so bear with me here. Does Canada have a registry of healthcare workers who can help people in need get into nature? What do you have to say to that?
Yeah, thanks for that question, Susan. And that sort of companion from the health perspective is actually it's really not a particular role that we have. And I think there's some great movement that's already happened in the U.S. locating health and health workers right within parks in that very material intersection. We don't have that type of role in Canada. What we do is this sort of integrated work of a kind of mind. And in our studies, we found those champions in the palliative care sector and those people that really pay attention, including, you can watch them in our short film, community health nurses, home palliative care nurses, that have kind of taken it and integrated it within their work at observing, you know, I'm going into someone's home visit and I see on the photos on the walls, I see that, you know, the mountain art, and I'm able to kind of make that connection and with that mindset, make the links. So we see it quite as an individual role. And certainly some of our chaplains in our hospices, you know, really have this mindset and make those connections for people, but it's really not fully integrated into both our parks or our health sectors or training. And it's something that we do advance further. And I think, again, like was just discussed, the idea of the momentum that we have now, I think we can work with that. And with so many of the lessons from this pandemic, we want to see those applied as we move forward. Thanks.
And I would say just one more thing to add to that is just the research really pointed to the importance of caregivers and people who, the entire community of folks who are supporting the palliative care, is empowering them to ask for it and empowering them to know that they can do it, and that it really was very much a grassroots approach and a grassroots initiative that really helped to bridge the gap between it being an idea and it actually coming to fruition. And that often when folks are not feeling very well, the idea of going outside is maybe not top of mind or isn't something that is seen as even possible. And so helping for that, to create that mindset and that bit of a shift so that people want to do it and will ask for help in doing it, that was truly powerful across the board.
Mm-hmm. We've got a good question here from Yvette Stewart. Do you have specific activities that can help younger people feel safe when experiencing grief in nature? And she references the sort of social stigmas that are associated with grieving, particularly in public.
Yeah, I would say we you know, some of the things we learned through our walking program was that this just very simple walks in a small group, it attracted people of all ages. People brought their animals, men, women alike, you know, and certainly in a lot of more formal grief and loss programs, yeah, there were stigmas attached, and we found that, but the very simple walking type of programming, and it doesn't need to be informal, and it was very much volunteer project here, but it can equally be a more family neighborhood based, just a very simple walking and noting and observing activities became really important in that project for all ages. So those pieces, bringing nature, art, books, stories, poetry in as well became really crucial for some of our participants in our end of life project, as well as disability project. And again, we focused on adults, but we can see these activities of bringing nature in through story and art and images, and simply observing through binoculars, observing through other images online or virtual experiences, all became very important for adults, and we can translate that to children as well. Any other thoughts? Jennell comes from an education background. So
well, and I think specifically for young people as well, I think, Sonya, the point you made earlier about the importance of companionship, I think is absolutely huge. And having flexibility in the approach to the way that programming and nature access is facilitated. So just understanding you don't have to sign up for an 8-week program in order to get the benefits. And so tapping into those programs or those program agencies or the organizers, and having a chance to have a real conversation over a cup of tea, and having the opportunity and the flexibility to make it be something that works for you and that you feel safe in doing. And the more that we're willing to humanize these processes and normalize them, the more we'll see these flexible program type approaches that allow for folks to be able to access the kind of help and support they need, and then be empowered to either volunteer or help support those agencies in a way that creates more responsive and relevant programming in the future.
Wonderful. We've got about 5 more minutes for questions. And one of the things that I was really struck by were the chalk drawings that you showed. And in a conversation that we had last week, Sonya, you said people love rebellion when people's rights are taken away. Those little moments of wildness, of wilderness, are small wild acts of rebellion. They are connections to nature. They don't need to be grand. I was reading a piece in the New Yorker last night about the 7 o'clock howl that's going on in support of the healthcare workers. And I'm curious, with so many of us sheltered in place now, what sort of small natural interventions can people implement in their lives when they're forced to stay at home? What have you seen as success?
Yeah, I think that's, we really saw that and you could see the picture of Ned's great escape. We saw this with a number of our hospice and palliative care patients, that kind of wildness and just being something a little seemingly surreptitious, that and the ash scattering for some family members in a kind of very secret place. And again, it's not necessarily an illegal activity, but just has this little tone of wildness. And we heard that response from our Alberta Parks was not to, oh, well, now let's hyper policy these experiences, but kind of enable them and support and think about how to make this meaningful. The connection to parks really is about creating meaning, and so that meaning can be created in these very kind of small and wild ways, and that we really are wild. There's meaning in that we are nature, and we can get that strength from the mountain. We can sort of feel the kind of flow so that wildness just comes from just observing, and sometimes that's observing indoors if we have particular barriers. Or on the 100-kilometer, the 1 kilometer stroll. But that little bit of wildness is there. One of the participants we sort of looked at his access to parks. He went to a park that was really just 20 minutes from his home, and he'd never been there. And his life became revolved around his hospice and palliative care appointments and visits. We got him to this park setting for a very small little stroll with his walker. He looked up at this kind of little hill. The breeze was there. There was a bird there that he looked up at. And he just was like, I got to get out more. What am I doing? This very kind of small. And it's, for him, this was a kind of rebelling against this routine and this palliative care. So the rebellion and the wildness can be very small and very much viscerally experienced like that howl that you talked about, the chalk drawings on the street. And the kind of storytelling and reminiscing that we also hear about from people. And again, it's not an act of rebellion to take out the old photo albums, but can be equally meaningful and inspiring for people.
Wonderful. We've got one more quick one. We've got a couple minutes left here. This one's from Kim Smoyer. Do you have tools for how to address cultural beliefs that might stop people from going outdoors?
I think one of the best tools that we've really come to has been the communication piece and the importance of listening, and to listen with simply the intent to understand. That for us, it was about creating those spaces so that we could sit down with a cup of tea and we could actually talk. And it wasn't just a one-time conversation, but it was something where we could revisit topics and really find out that cultural, that every barrier, whether it be cultural, physical, what have you, is inherently very personalized. And so by taking a step away from something that is capital P programmatic and really looking toward a more personalized approach, that in and of itself was the absolute best way of approaching cultural barriers or physical barriers or what have you. And a big part of that is agency to agency collaboration. And so not expecting your staff to know everything, but have helped to build within your organization the mindset of reaching out to other agencies whose job it is to facilitate those cultural responses and ensure that you are supporting each other's mandate in a way that is appropriate and helps to actually build on the strengths of your agency without actually taking additional resources that can't be applied in other ways.
Well, thank you both very much for your time here today. We've really appreciated it, and we appreciate your research, and particularly in this moment as we try to figure out how to move through the coronavirus with some grace and elegance. It's nice to know that there's a lot of data supporting what we know intuitively as parts of the natural world. I did want to point out that we will be putting this up on our YouTube channel. You can Google it. The slide deck will be on Figshare for those in the research community. There are references at the end of it. And again, our Slack community is at Shift Nature and Health. We really encourage you to continue the sorts of sidebar conversations that this webinar has been provoking in the Slack channel, where you find a lot of other folks who are very interested in this intersection of health and nature. A couple of points. Our next webinar is with Dr. Michael Tuddy. He is the Group Vice President of Professional Satisfaction and Practice Sustainability with the American Medical Association. So with our healthcare workers at the front lines of the war on COVID-19, we're going to be looking with Dr. Tuddy, as well as a couple of other physicians, at stress in nature and how we manage clinician burnout during the pandemic. That is next Tuesday, April 21st. On April 28th, we'll be working with Brenda Schmidt. She is the founder of Solera Health, currently the president of Coplex, looking at nature as a social determinant of health. And of course, Brenda's specialty is figuring out how we pay for all of this. So the creation of sustainable revenue models for nature as a public health intervention strategy is a critical issue that we've been working on with Brenda, and we're looking forward to that on April 28th. So again, our Emerging Leaders Program applications are still open. The deadline is the end of May, and you can find information about that on our website at www.shiftjh.org. Dr. Morgan Green can field any calls about that. And then, of course, we're always looking for nominations for the Shift Awards. We look around the country for initiatives that are advancing and promoting the health benefits of time outside, and we evaluate them on the basis of impact, innovation, and replicability. And then we build the programming at Shift around the folks that we deem to be the most valuable and the work that is really pushing the needle. So if you've got work that you'd like us to consider, please, again, look at our website at www.shiftjh.org and nominate your work if you believe it merits consideration. So thank you both very much for your time today. Good luck sheltering in place. I hope you get a howl in this evening to reconnect with your wildness. And we'll look forward to seeing you all here again next week, same time, same place. Thank you.